Hello, I'm Ollie and I'm a dietitian. Today, I want to share with you tips to treat iron deficiency in pregnancy within weeks. This video will be helpful for you if you're pregnant and you've been diagnosed of having iron deficiency, or you are pregnant with more than one child, or you've had two pregnancies that were close together, or you were diagnosed of having low iron levels before you became pregnant, or you have IBD, or you are a vegetarian. Join me as I take you on this challenge to fix iron deficiency in just a few weeks. Now, iron deficiency is a common issue during pregnancy, and it's not something to be taken very lightly. Both the mom and the baby can be severely affected if maternal levels drop too low. It could lead to issues such as having a preterm delivery, giving birth to a child with low birth weight, and there is also the risk of the mother developing postpartum depression, and in extreme cases, it could lead to the death of the baby before or after delivery. If iron deficiency is not also treated, it could lead to other issues like heart problems or poor cognitive function in the baby. And here is this one. Research has shown a link between maternal iron levels and mental health illnesses such as autism and schizophrenia. I am not saying all this to get you anxious, but to let you know that this topic is not to be taken very lightly. First, how do you recognize iron deficiency, or what are the symptoms of iron deficiency? Fatigue is one of the most common symptoms of iron deficiency, and most times it is often mistaken for normal exhaustion that happens in pregnancy. But if you're feeling like you're dragging yourself through each day, such that simple tasks leave you breathless, then it could be a sign that your iron levels are low. Now, other symptoms of iron deficiency include pale skin, shortness of breath, chest pain, especially with light activity, rapid heartbeat, palpitation, headache, dizziness or lightheadedness, cold hands and feet, brittle nails. Cravings is another one, craving for non-nutritive substances like ice, dirt, or starch. And if you are experiencing any of these symptoms, please speak to your doctor about getting your iron levels tested. So, what could cause iron deficiency in pregnancy? First, there is increased demand for iron in pregnancy. The baby or the babies usually get their iron supply from the mother's stores. And if the mother is already low in iron, for instance, if the mother experienced heavy menstrual bleeding before pregnancy, or the mother has some health conditions such as irritable bowel disease, or a condition known as thalassemia, where the person has difficulty making hemoglobin, or if the mother's diet is low in iron, for instance, a vegan or vegetarian woman, or a woman who experiences frequent vomiting in pregnancy, or a woman who have had weight loss surgery, these conditions can increase the risk of a woman having iron deficiency in pregnancy. The major issue with iron deficiency in pregnancy and with just about anyone else is not actually iron consumption, but it has more to do with iron digestion and absorption by the body. People consume foods containing iron, but the body is not able to absorb much of the iron in this food, and that is what we're going to talk about in a few minutes in this video. There are two forms of iron in foods, the heme iron and non-heme iron. Heme iron is iron from animal sources, and they are very much absorbable by the body by up to 25 to 40%, while non-heme iron are iron from plant sources, and only less than 10% of these are absorbable by your body. Also, plant foods contain compounds that inhibit iron absorption, such as phytates, oxalates, calcium in foods, tannins in coffee and tea. So let's look at 10 tips to increase iron absorption in your body and treat iron deficiency in pregnancy. Number one, the first tip is to eat more of foods that are high in iron, which is animal sources of iron. So if you're open to eating meat, the best way to boost your iron levels is simply by consuming meat. Iron availability in meat is up to 70%. Also, iron in animal foods are not affected by iron inhibitors, which is why most of the iron in animal foods are bioavailable. Red meat is an excellent source of iron. Poultry and fish are good sources. Pasture-raised eggs and sardines, any meat at all. Look, even the lowest iron containing meat is better off than plant sources. The best animal foods that stand out here are oysters, clams, and beef liver. Please, pregnant women should avoid liver because of its high vitamin A content, which can be harmful for your baby. So if you're pregnant and watching this video, please avoid liver. You can still eat clams, oysters, and other meat. The second tip is for people who are averse to eating meat, people who are vegetarians or vegans, or anyone who for religious reasons do not eat meat. My recommendation for people in this group is first, consider eating meat as medicine. Considering the risk of iron deficiency in pregnancy, you may opt to eat faceless meat like clams, oysters, and eggs, but this is just a recommendation. But if your mind is made up and you can't tolerate meat in pregnancy in any form, the other tips would work for you. Tip number three is also for people who are not open to eating meat, and it is to eat a variety of plant foods rich in iron. So we already know that iron in plant foods has a low absorption rate. So increase the amount of iron you consume by eating a variety of these foods. There are plant foods rich in iron: beans, lentils, spinach, soybean, beetroot, water leaf, apricot, cashews. Another great option is fermented foods like kimchi, sauerkraut, and miso. The fermentation process makes the iron in them much more bioavailable by your body by up to 100%, and it reduces the anti-nutrient content of these foods. And you can easily add this food to your meals, to your salads, or use them as a side dish as well. Tip number four is to always pair plant foods rich in iron with vitamin C rich foods or vitamin C supplements. When having iron from plant food sources, always pair them with vitamin C rich foods like citrus fruits, bell peppers, broccoli, tomatoes, kiwi. Vitamin C increases iron absorption by 6 times, but they have to be taken together at the same time. If you have vitamin C rich foods a few hours apart, they will not work. Tip number five is still on plant sources of iron, and it is to cook or soak them. So, soaking your beans, your lentils, and cooking your vegetables reduces the amount of phytates, oxalates, and other anti nutrients in them. So, the iron in them are better absorbed by your body. And tip number six is to consume iron fortified cereals. Yeah, you can also get enough iron from fortified cereals. You can get up to 5 milligram of iron in a 30-gram portion of fortified cereal. But again, they are also not easily absorbed by your body because the iron in fortified cereals are still non-heme iron, and it is difficult for your body to absorb. So you still need to increase the absorption by pairing them with vitamin C rich foods or supplements. Okay. And tip number seven is around improving your gut health to increase iron digestion. So here is the tip: use apple cider vinegar with your meals. For pregnant women, please choose pasteurized apple cider vinegar as this is safer for your baby. Now, one of the issues with iron absorption has to do with low stomach acid. Low stomach acid inhibits the absorption of iron, but apple cider vinegar increases the stomach acid, which is helpful for converting ferric iron to ferrous iron, which can then be absorbed by your body in a better way. And please don't forget to dilute apple cider vinegar in water and drink from a straw. So before we proceed, if you're getting value from this video, could you please click the subscribe button to support my channel? Also, like this video to encourage the algorithm to promote my video. And thank you. So tip number 8 is about iron supplements. You may have been prescribed iron supplements by your doctor. Your doctor may not have told you to consume iron supplements with vitamin C rich food. So please take your supplement with vitamin C rich foods as mentioned earlier and take them at the same time. Still on supplements, when taking iron supplements, don't take other medications 2 hours before or after your iron supplements, as some medications affect iron absorption, and iron itself also decreases the effectiveness of some medications. And tip number 9 is to avoid iron inhibitors around your meal times or the time when you have your supplements. So do not take iron supplements or your meals with dairy products, tea, or coffee 2 hours before or after your meals. And tip number 10 is start cooking with iron skillet for some bonus iron. And finally, a bonus tip for you is if you're taking iron supplements, be sure to hydrate properly and also consume fiber rich foods to combat constipation. Many people are unable to tolerate iron supplements because it makes them highly constipated. So, proper hydration and a high fiber diet can ease constipation so you're able to continue to take your medication. So, here are 10 tips to treat iron deficiency in pregnancy quickly. Remember, iron deficiency is not something to be taken lightly, and it is crucial that you prioritize your health, and the health of your baby during this period. Thank you for watching my video, and I would love to hear about your experiences with iron deficiency during pregnancy and which of these tips were helpful for you or which of them do you plan to start working on. And please do check out my channel for other lovely content as well. I'll see you in another video. Thank you. Bye.